What is ODD? Oppositional Defiant Disorder, or ODD, is a behavioral disorder characterized by a recurrent pattern of defiant, disobedient, and hostile behavior, often towards authority figures. While many children and teens display oppositional or defiant behaviors, children with ODD will go beyond behaviors that are typical for their age and development. These behaviors include arguing with authority figures or adults, aggressiveness towards peers, deliberately annoying others, spitefulness, and vindictiveness. While there is no specific cause of ODD, there are some factors that are correlated to the development of the disorder. This would include an unsafe or unstable home environment, overly authoritative or permissive parents, and parents who have been diagnosed with mental illnesses. Children who have ODD often have other disorders as well, most commonly ADHD, anxiety, and depression. While researchers have not agreed on the percentage of comorbidity between ODD and ADHD, studies have shown it being anywhere from 40 to 80%. Some researchers actually suggest changing the classification of ODD into a predominantly oppositional defiant type of ADHD. This change would lead to physicians identifying symptoms earlier so they can put in place early interventions. It would also encourage increased and improved research of the disorder. Ethan is a child who is diagnosed with ODD and ADHD. He also has high-functioning autism, and physicians are assessing him for the diagnosis of bipolar disorder. Parts of his story were shown in the documentary A Dangerous Son.
I just can't help myself because it's just what I usually do. I don't know how to control my anger. Gosh, only if someone's life.
What'd you say?
I'd say if there was a lifeguard who could help me try to control myself. Because you know lifeguards are good, right? Yeah, they save everyone, even when they drown.
General treatments for ODD include collaborative parent-child therapy and parent training. Early prevention programs like play therapy can decrease symptoms of aggression. Medications are recommended for students with comorbidity and are more effective in conjunction with therapeutic approaches. Later in the documentary, Ethan is deemed in crisis by a state agency, so he qualifies for short-term residential treatment once there is a bed open for him. He has been at the home for 3 months.
I'm going home in 3 months. It's up to the staff. So, I don't go home for a while. Because, I'm never going to go home yet until, I keep working on my behavior. But, I'm still learning and, yeah. I swiped my belt, but then they took my belt away. At least they let me keep my other belt, but only if I'm safe.
Why'd you swipe your belt at the door?
Because I got super angry. But that was a long time ago, so yeah.
While educating these students can be a challenging process for teachers, there are possible strategies that can be used with students with ODD that will benefit the student and the teacher. The most productive strategies are preventative and proactive. One aspect for instruction a teacher can focus on is their tone of voice. There should be 3 tones of voice used in the classroom: a neutral tone for giving instructions, an upbeat tone for encouragement, and a stern, steady tone for reprimands. No yelling or sarcasm should be used, for they usually only escalate a situation. Classroom expectations and rules should be clearly stated and understood. Do not punish a student for something that was never explicitly stated to be against the rules. When expectations are not followed, have a well laid out backup plan. Prepare for the student to be undeterred by the first, second, or third consequence. Another strategy is to prepare the student for situations that might become potential conflicts. If a student has challenges transitioning, warn them beforehand and prepare them. A high rate of praise and positive reinforcement is considered to be one of the most important strategies. It will demonstrate that what the desired behaviors are and what is expected of the student. It has been also proven that if the student has a good relationship with the teacher, they will have less instances of misbehavior in the classroom. Being respectful towards the child, trying to learn more about them, and working on building a close relationship will encourage the desired behaviors. Although preventative measures are helpful, a situation will probably arise where there is a conflict in the classroom. When this occurs, give concise and specific warnings that can be backed up. Do not give choices. Instead, give clear, definitive statements. Communicate with parents about strategies that work for them at home, and use trial and error to explore what will help the individual child. Accommodations can be used to aid students with ODD as well. One of the most commonly used and effective accommodations is a behavioral management plan. The plan will define behavioral expectations, procedures, and consequences for the student. The plan should be specific to the student and based in functional assessments, or assessments that identify the specific target behavior, the purpose of the behavior, and what factors continue the behavior. These assessments should include the student in the conversation, asking them specifically, why do you misbehave at this time, and how can we prevent this together? A plan might include a behavior checklist that keeps a daily record of how the student is doing and if they are meeting their expectations. In order for students to reach their goals, there should be supports in place, like behavioral instruction. Teachers should systematically teach social skills, including anger management, conflict resolution strategies, and how to be assertive in an appropriate manner. It is also helpful to discuss strategies that the student may use to calm themselves down when they feel their anger escalating. Every student in the classroom deserves the opportunity to achieve. While students with ODD can be challenging to educate, they have the right to a caring and compassionate education that considers their individual needs. Using targeted strategies and accommodations can make content comprehensible and success achievable.